Hello, everyone. My name is Dan Toner. I'm the health insurance broker for Caring with Compassion, and I'm here sharing my screen to go over an email that you're going to get this week talking about the open enrollment. The health plans all renew on July 1. We are offering the same two Aetna plans, but we're adding a third. So there's going to be three Aetna plans. I'm going to go over that in summary with some additional stuff that I think you'll like. We're going to keep the Delta Dental plan. Their rates are a little lower this year, so that's good. And we're offering a brand new employee paid voluntary vision plan from Aetna, so new coverages as well. I am attaching a couple of different things. I'm going to go over the summary. This is a summary that you're going to get again in the email. It's going to talk about all the plans being offered. In order to be eligible, you have to work 30 or more hours a week. Otherwise, you cannot participate in the health plans. For new hires, there's a 90-day waiting period. So right around that second month of employment, you'll be getting a welcome email from my team welcoming you to Caring with Compassion and going over these same coverages. For today, though, we're doing open enrollment for most of you. So here's what we're offering. 3 medical plans from Aetna. 2 exist today. Delta Dental, same plan last year, rates are going down, and a new voluntary vision plan. Keep in mind a couple things about the Aetna. All 3 plans are nationwide. All 3 plans, you do not need to pick a primary and get a referral to see a specialist. It's called open access, meaning you can just go right to an in-network specialist. No referrals are needed. Aetna did give an out-of-network coverage for all 3 plans. Some of these plans were in-network only last year, so all 3 plans have a function that you can, or a feature that you can go out of network if you're seeing a non-Aetna doctor. Now, out of state does not mean out of network. Again, all 3 plans are nationwide. So you have in-network coverage in New Jersey, New York, Pennsylvania, any of the 50 states. So nationwide coverage, but all 3 have an out of network. Keep in mind one thing about out of network, there's a significantly high deductible that you have to access before you get coverage from Aetna. So even though there's an out of network benefit, most of you should be staying in network. The core plan, our base plan is called the 8150. The second plan is called the 2500 with 80% coinsurance. These are the 2 plans that exist today. And we have a third plan with 100% coverage after the deductible. So we're going to go over that right now. The base plan is your lowest premium because it says when you go to your primary care, you pay nothing. When you go for urgent care, now that's not at a hospital like an ER, that's at an urgent care like a Medi-Merge, a City MD. You pay nothing to go to those facilities, and you pay nothing for generic drugs. Everything else is part of an 8150 deductible with Aetna. That means you pay the Aetna discounted rate, but you owe the entire cost up to 8150 and then nothing. So it's a kind of unique plan. Your premium is at the lowest. And for many people that only see primaries, go to urgent care and get generic drugs, it's probably a phenomenal plan. And that's why we're offering it as a base plan. Some people are saving a lot of money out of their paycheck. And even though like a specialist or a name brand drug is part of your hospital and surgery deductible, if you only pay it 1 or 2 times, think about what you're saving out of your paycheck. So a lot of people are considering this base plan. The second plan is existing today. You'll pay an additional fee out of your paycheck to belong to this plan where you have copays to the doctor, 35, specialist 75, urgent care 75, anywhere from $3 to $10 for generic drugs, and anywhere from $50 to an $80 copay for name brand. So you're going to pay more money to jump from the base plan to this plan. This 20% coinsurance is referring to when you have things like hospital, surgery, or radiology, like an MRI, CAT scan, and PET scan. You have a $2,500 deductible. You owe 20% of the bill, but you can't spend more than $6,500. So no matter how many hospitals, surgeries, and MRIs you have, $6,500 is your worst case scenario for the entire year, calendar year. You double it if you have a family. So the family would never pay more than $13,000. But that deductible and 20% don't apply to doctors, urgent care, or drugs. That's a simple copay. Again, this plan exists today. One of the things we changed is we purchased 100% coverage for lab and x-ray. The lab and the x-ray were part of the $2,500 deductible. Starting July 1, lab and x-ray are free. So that's an improvement made to this plan. The third plan is brand new because some people have voiced that I don't like to owe 20% for things like hospital and surgery bills. So we're doing this third plan, brand new, that says after you meet your $2,500 hospital, surgery, and radiology deductible, you owe nothing. So you're going to be far less likely to hit this out of pocket of $6,000 when you owe nothing for hospital, surgery, and MRI after the $2,500 deductible. You'll pay the highest premium for this, but it's really not that much. So some of you that are anticipating a lot of high cost bills may want to consider option 3. This is a little brief summary about the 3 that I just talked about. And these are your costs. So you'll see them on a selection sheet, but basically these are the costs if you want to be a single. The second is if it's you and a spouse. The third is if it's you and children, 1 or more children are covered up to the age of 26. And if you're a family, that's you, spouse, and children. So these are the 4-tier rates. These are your costs. So you can see the lowest costing plan out of your paycheck. The other plan, the point of service 2,500 that exists today with the 80/20 coverage for hospital and surgery. And look at the upgrade to have 100% coverage after the hospital and surgery. It's not that bad. Okay. Dental is here. I think this was about $27 a paycheck. So Delta lowered the rates because more and more people were getting covered. So that's a good thing. Same plan design, but the premiums are lower. And this is the new Vision for $2.78 a single. It's kind of hard to beat. Always a reminder on when you log in, if you have medical, if you have vision, go to the Aetna website, log in with your ID number, create an account. You can look up doctors. This is where to find the Choice POS2. That's the national network. And on the dental plan, we're not changing any of the coverages, but I do have a copy of the dental benefits right here. You'll have 100% coverage in and out of network for what's called the Premier Network of Dentists. 80% coverage for things like fillings, endo, perio, and sealants, and 50/50 coverage for crowns, bridges, implants. You get a maximum benefit of $2,500 for every person enrolled. So if they're paying 100% for a checkup and cleaning, let's say it's $200, that means you have $2,300 to use for other services. So every person enrolled gets $2,500. That's what that means. Vision is brand new. This is a hyperlink on how to look up Aetna's vision providers. Vision is a combination of a copay. Keep in mind that vision is not covered under medical unless you have a medical procedure or condition like glaucoma or an accident. If you're looking for routine checkups and reimbursement for lenses and frames, you need a vision plan. What Aetna does is give you a $10 copay to get your eyes checked every year. They give you a copay when you buy a pair of glasses. There's a copay of $25 for the lens. You then get a cash $120 cash $130 cash plus 15% off. You also can do contacts in lieu of glasses. So you're getting a combination of a copay, cash reimbursement, and a discount, all for like $2 a month as a single, etc. So it's a pretty inexpensive, affordable benefit, and we're adding that. How to enroll? You're going to write your name in the top. This is the medical. You'll see a little brief summary about the 3 different plans. And at the bottom, you will see the costs that I just discussed. You'll go to the dental sheet, write in your name, and select how you want to be covered. You will click decline if you don't want to enroll. And you will sign at the bottom of each page. And then there's the vision and the cost to participate. By the way, you can be a family for medical and a single for dental and a couple for vision. They're all independent of each other. We need everybody to fill out these 3 different sheets, sign and date, and get it to Victoria on the 21st. That's Friday, the 21st. The last page of the kit is how to get in touch with Aetna, how to get in touch with Delta Dental, and how to get in touch with me. I am Dan Toner, and my support is Amanda and Leslie here in FFP, our broker office. So that's all I have, and feel free to contact me with any questions you have. And I wish you luck on open enrollment, and have a great day.